Hi, I'm Dr. Rajeswaran, endocrinologist and bariatric physician. You must be wondering why this word bariatric physician comes into my title. Well, I started off as an endocrinologist, which is to do with hormones. So deal with people with thyroid problem, diabetes, pituitary, adrenal. So that's what I was doing, and that's what I've been trained in. But in the first 2 years of my practice, I found that most of my patients, especially with type 2 diabetes, nearly 90% of my patients with type 2 diabetes had a weight problem. And then I found that all we were doing is increasing medications for diabetes, trying to get the sugar down. And similarly for thyroid, people with weight problem had thyroid problem, a significant proportion, and we were increasing the dose of thyroxine. So I was getting more and more disillusioned that what we were doing is we were barking at the wrong tree. So this is when I got interested into obesity. But when I started practicing obesity 20 years ago, my colleagues said, no, it's not right. It's the remit of dietitians, or it's the remit of Weight Watchers and Slimming World, where they look after patients very well. And there's no point you as a doctor doing this. But somehow I stuck on to it. And now you can see that it's a worldwide problem where more people are dying of obesity than malnutrition and infection. So I think I was right. I picked up the right subspecialty, and I'm glad I'm trying to help a few patients. But what I need to tell you is, in this last 25 years, as I get myself trained and learn more, I find that I know less and less of this area of medicine. It's such a vast field, and people are still studying about this. It's not straightforward. So you can't blame the doctors because this field is in its infancy. Similarly, you can't blame the patients because patients are learning as well, because it's not just about food and exercise. So I'm sure we will get a solution to this in the next decade or so.